Paulo Costa has been pulled from UFC 294 after doctors are concerned that he has an ongoing staph infection in his right elbow. Welcome back, everybody. I'm Dr. Brian Sutterer, and my goal in this channel is to help teach you about the medical side of the sports world. So if anatomy and that sort of thing interests you, then please consider subscribing. So the latest updates we just got, of course, we've been following this whole storyline with Paulo Costa and what he's been dealing with this right elbow. Now this picture is confusing in terms of the timeline with when he had surgery and what pictures are sort of pre and post-surgical, but at least in this one where we see all this erythema or redness around his elbow, it does look like we can see that surgical incision site. So there is that healed incision site where the stitches have been removed, but certainly a little area in particular right down here at the lower portion of that elbow where it looks like there could be some residual swelling. And with all this redness is a sign of underlying possible infection. Everything looks like it's healed up well from the surgery site, but if there's infection in the elbow, of course, that's a high risk of spread, and we don't want that to occur, hence why he was pulled. Costa himself confirmed this, saying that basically he got a staphylococcus bacteria in his elbow, and doctors were pulling him out of the fight. If we compare and contrast what we were seeing here, of course, this was the picture where we could see those surgical stitches, the incision site, and just look how clean all this looks. There's no redness, everything looks nice and normal, no concern for infection. We don't even see anything down at this lower portion of the elbow. And then if we look at the picture that Costa has right here, we can see stitches have since been removed. So presumably this is after the surgery. Now there's this kind of swollen area right down here. There's all this surrounding redness. So definitely concern for infection at that site where he had that surgery. Talking about the initial injury itself. So it sounds like Costa was dealing with something called olecranon bursitis, or potentially an infected olecranon bursa. Now we don't know if it was infected before or after the surgery, but if we look at the backside of our elbow, bursa are these potential spaces around our body that typically sit around tendons and the skin to help kind of provide some lubrication or reduce the friction as tendons are sliding relative to the rest of our tissues. The olecranon is the bony prominence on the backside of your elbow. So whenever you bend your elbow up, that bump right there, that's part of your ulna, which is the bone down here in your forearm. There's a little collection, a little area where fluid can build up on the backside of that olecranon called the olecranon bursa, shown right here. We can then, of course, see the triceps muscle and tendon coming down the backside. It's more common for people to get olecranon bursitis more from just friction or local trauma as opposed to infection. So certainly somebody who's doing a lot of wrestling, a lot of repetitive friction, say on the mat, you can get irritation in that bursa that causes it to get inflamed and start to swell. If it's not going down, if it's not responding to getting drained, doctors will go in and surgically remove all that extra bursal tissue to try and help with symptoms. But then of course, you run the risk after having a surgery of something like this occurring where you can develop some infection in that underlying tissue. And just again, the timeline here, we don't know exactly when this picture was taken relative to the surgery, but the fact that we can see that surgical incision site, the stitches are removed, presumably this would have been after the surgery and definitely concerning for infection. The specific bacteria that he was talking about, staph, we've all of course heard of MRSA. So MRSA stands for methicillin-resistant Staphylococcus aureus, and that's just a more kind of higher risk, difficult to treat strain of bacteria that is a staph species. We don't know if that's what Costa has here, but certainly could be. And absolutely, if someone's going to be grappling, touching skin with somebody else, you don't want to run the risk of spreading a staph infection over to somebody else. It sounds like Costa is going to have to go through another procedure to drain out another area of fluid, probably be on antibiotics. So this is something that, while it shouldn't be concerning for his long-term health and potentially could have him back later in the year, totally understand why doctors would not clear him to fight with how close of a timeline this is, with concern for active infection within his elbow. The last thing I'll touch on here real quick is with Charles Oliveira. Of course, we saw he had that nasty cut over the top of his eye that certainly is not going to be healed up in time for him to fight. The one important thing though that Dana mentioned in his interview is he said he wished that they would have called to have a plastic surgeon come out and stitch it the proper way from the deeper portion to the outside. Whenever you have a deep incision or laceration like this, one of the more proper ways to stitch it back together to heal better, to be stronger, is to actually suture up the deeper layers of subcutaneous tissue before just throwing in superficial stitches. The concern here is probably that they might have just thrown in some superficial stitches because doing the deeper, better laceration repair is probably going to take more skill from somebody like a plastic surgeon. And when we're talking about lacerations like this over eyes, we've all of course seen what happened with Nate Diaz, and so it's a big deal to really get good closure here and I can 100% understand why Dana White was a little bit disappointed in that. Nevertheless, hopefully UFC 294 still shakes up to be a great night of fights. I think the additions are going to be really exciting with Usman now taking on Chimaev. And so I hope this video was educational. Take a look at what's been going on with Paulo Costa and touch on briefly with Charles Oliveira. Let me know as always any questions or comments down below and who you have picked for these fights. And until next time, we'll see you later.